everyone. Welcome to Soul Talks. Today we have a really special guest with us. We have Dr. Shilpi, who's MD Pediatrics, and she'll be sharing her thoughts with us today. And we'll be having a great session. So, ma'am, would you please say some lines about yourself and introduce yourself to our audience?
Hi, I'm Dr. Shilpi Jain. I'm a pediatrician associated with Apollo Hospital, Delhi. My main area of interest is neurodevelopmental disorders in pediatrics in children, and I would, today be speaking upon how we can bring about sustainable mental well-being for the society at large.
Thank you so much, ma'am. And it's an immense pleasure to have you. So, shall we start with our interview today? I think everybody is really intrigued towards hearing your viewpoints, and so let's just quickly go towards it. So, as you're a pediatrics, you'll be having patients all day long, and parents come with specific needs for their child. And do you think just if they come for their child's health, do you think parents sometimes take a toll of their child's health on their mental health? They're super worried about their tiny ones. Do you think?
Yeah, of course, there. Most of the times, the practice is mostly counseling of the parents rather than treating the kids.
Exactly. What suggestion would you like to give to them for it? Like, how can they be a little calm when it comes to a child's mental health?
So here I will, deviate. So most of the parents are not worried about their child's mental health. They rather overlook it. They are more concerned about physical growth and other developmental growth, perhaps. But mental health is not the focus here. But yes, for most of the parents, I would say that they should encourage their children to have a more open communication with them, to be able to talk about their feelings. They should encourage their children to be more active, should focus on eating well, drinking more fluids, eating good nutritious foods. They should focus, give more positive reinforcement and positive feedback for the achievements that the child is able to make. They should encourage their children to learn new skills, or do encourage them to develop hobbies, to indulge in something which they would enjoy to do, rather than, just a sole focus of studying or excelling at something. So yeah, those are the things wherein I would want the parents to concentrate more than the basic objective goal of excelling in studies or a certain sport.
Right. And ma'am, how do you manage your mental health? Because you have to hear the patients out all day. There's so much work pressure, and you must be having a family that you need to work around. It's too much on the head sometimes. So how do you manage your own personal mental health?
Undoubtedly, as a working female, there are days when you are very, you just think that it's the end of life. But I would meditate. I meditate pretty regularly, and then I'm lucky to have some support groups, friends who are associated with me, who I can keep in touch with, communicate with, discuss my feelings, or have a cup of coffee with. And then yeah, definitely having more healthy eating habits, exercising, controlling my water intake. These things help. At the end of the day, you should love what you're doing, and if you do that, it is less stressful anyways.
Absolutely. And the way you were telling it so lightly, it just makes the other person believe the fact that you just do it and things are fine. The fact that you said having a cup of coffee, it's right. I think at some point of time, you need that cup of coffee with your friends.
Yes.
To just let it out.
Yes, definitely.
So shall we move on?
Yes, sure.
So according to you, what advice would you give to our audience to sustain a better mental well-being? Like tips that you give yourself, what tips would you like to give to our viewers for all age groups?
As I just mentioned, like, first and foremost, we should learn to talk about our feelings. If we should learn to communicate often with others, because what we are feeling, other people cannot understand or cannot really fathom what we are going through till the time we, get to that. Then it is very important to stay active, exercise regularly, to eat a balanced, nutritious diet, and to drink a little more sensibly, use your alcohol or substance abuse if you think that. keeping in touch with friends. Like COVID, if it taught us one thing, that it is very important to stay in touch with other people. We are at the end social beings, gregarious people. And then every now and then, adults should learn to take a break. You need to sometimes step back from what you have been doing, or from your responsibilities. Take a break. You deserve it. And just like how children should be encouraged to indulge in hobbies, we as adults should also be doing something which we are good at, which we enjoy doing, or at times it helps to learn new skills as well. So I think those are the pointers which should help my parents as well.
Right. I think the tips are for ourselves is the ones that should be given to other people, because if something resonates to us, I think surely it will
Yes,
resonate to other people as well. And the good thing about your tips are is that it's something that you believe in, so that makes other people more convinced about the fact that this is something I need to follow up. Moving on. So, being a pediatrician, what are the major drawbacks, concerns you like when it comes to lack of mental health among young children? Because people don't face it, the fact that mental health is very important for children, and we do not give the prior importance. So, what
So
drawbacks
I
that
will start here by telling you that the mental health survey stats are very scary in our country. So the last national mental health survey indicated almost 7.6% of adolescents
Right.
um, are contemplating suicide in our country. The prevalence of mental illnesses in children is nearly 26%, and only 1% of them seek treatment. Okay, so that brings me to the first drawback, is that there is lack of mental health issues, awareness about mental health issues in children and adolescents at large. We do not expect children to be anxious or depressed. We think they have everything in life they need, so we don't really encourage our children to talk about their feelings. That is first thing. Second thing is, there is a lot of social stigma attached to all mental health illnesses. So, people would not, even if they realize, they would not approach a proper trained professional for the same, because of the social stigma, because of the embarrassment which may be associated with it.
Right.
There is a genuine lack of trained personnel in the country. Not enough people are trained, and more so in pediatric mental health care. Very few people are very well trained child psychologists who can, deal
Right.
with these issues. And then there is a financial cost involved in all of this. Not everybody can afford these therapies,
Absolutely.
and that is a huge setback to availing the treatment. So if we can somehow bridge these gaps, I think it would go a long way in improving the conditions.
Right. Like you were talking about the financial thing, I think it's a very big aspect. I think a
Yeah.
lot of people cannot afford a 1,300 an hour session, or
Session.
3,000 an hour session. It is not a very possible thing. And do you think what can the government do about it? Should they provide
So
some
the
aid?
government has definitely been a little more active about it, and even in COVID times, they launched a lot of tele consultation facilities, like Manodarpan for adults as well as children. Something, these are the facilities which they have launched in the COVID eras, wherein people can talk about the post-traumatic stress disorder which they are having, or anxiety which they are facing. And also at the community level, they are now promoting social help groups, the Anganwadi workers, even at rural areas. The
Right.
panchayat is being trained to discuss and talk about mental health issues, mental illness which may be plaguing the youth in these uncertain times.
Right.
So there is a national mental health program, which then goes down to the district mental health program, wherein now they are providing at the primary level trained mental health personnel in all the district hospitals. That would take some while, but at least they have started doing it.
Absolutely. And I think as our government is taking up these initiatives, do you think even the celebrities nowadays, they're openly talking about their
Yes,
mental
yeah.
health?
Deepika Padukone, for example, she's one of those most of the people follow, and she talks very openly about her own issues of depression. And
And do you think it's it's very good, I believe, because we sometimes look up to celebrities, and when they're talking about the fact that they are suffering, we do relate, and sometimes we feel open about it, right?
Yes.
So is there any instances in life that you felt that you might need some help because you are like, is there any instance in life that you feel that
Many a times, and I think particularly when I was in college, medical college is strenuous. It's not a easy thing to go through. Loads of studies, loads of competitiveness, and not always very healthy competition.
yeah.
So I had a proper panic attack at that time. But luckily for me, as I said, my parents are supportive. They were very supportive even at that time. They helped me through counseling, and my friends were very supportive. They were with me all the time. They were helping me through all my anxiety issues, and so I was lucky enough to have that. But unfortunately, not everybody is, and not everybody knows. They are not even aware that there are channels where they can approach and discuss their feelings, or have a let down, have like really let go of what is plaguing them. So
So just to lighten up the mood in the conversation, we'll be doing the rapid fire round now. And so in this session, we'll be asking you questions. You need to be really rapid and full of fire. So I'm sounding like coffee with Karan like now. But the questions will have a lot of conjecture, and you need to answer really fast so that our audience can have a good time.
So let's see.
Okay. So, do you think mental health professionals are not given equal importance than other mental health, other professionals in the medical field? Do you believe that?
Yes, so far, no. They should be given more importance, but so far they are not being given equal importance.
Okay. Moving on. So, are you a morning person or a night owl?
I used to be a night owl, but now I'm a morning person.
Okay. So, what is your one-step therapy for yourself?
Listening to music, just singing along with some nice song.
Okay. The person that can calm yourself.
The person that can calm me.
Yeah.
My son, for sure. He comes to me, gives me a hug, and the day is better.
So my next question was, who was your bundle of joy? I think I know the answer.
Yeah, my son again.
Okay, your favorite book?
It's not a non-fiction. Very difficult. Okay, I don't have a favorite book, but yeah, I like most of the books by Sidney Sheldon, and yeah, one of my most If Tomorrow Comes is my favorite book.
So what's your comfort food?
My comfort food is chole bhature. Sorry.
You don't have to be. So if all the babies you are listening, and if you're having chole bhature, you know where you need to go for the treat.
Yeah.
Your dog is having
chole bhature every day.
So shall we move forward? I think the mood is light now. It's too much fun that we had. So I think we should move on.
Yeah.
Okay, let's go to the serious part now. Our planet, our health. How can the environment help us to shape our mental well-being?
So our planet, our health is the WHO theme for 2022.
Absolutely.
And it goes a long way. So environment can both positively and negatively influence the mental health of a person. Okay.
Right.
Like for example, air pollution, which is crossing all limits in our, particularly in Delhi NCR where I stay. Air pollution is particularly harmful both physically and mentally. There is a clear connection between high levels of air pollution and conditions like anxiety, suicide rates, depression. So if we work towards improving these environmental factors, or for example, if we were to live in a more natural surrounding, we would be more calm, we would be there'll be more feeling of health, happiness and wellness. So environment definitely shapes our mental well-being at all levels.
Right.
And also the micro environment, as in the familial environment, how the parents are connected together, how the society is treating you, is also, it goes on to shape our health completely.
Absolutely right. I think if the environment is happy, I think the soul gets happy.
Yeah.
if you need to choose like one destination that can give you mental peace and some therapy to your head, what will you choose? Like a destination, if you have to choose, like one good environment for you.
Beachside, I think the sound of waves crashing is very relaxing. So I would want to go to beachside.
I think the sound of the wind makes some calmness out of yourself.
Yeah, yes, yeah.
So I think now the question to be like, if you're a beach person or a mountain person, I know the answer. You're the beach one.
Mostly a beach person.
Okay, so you generally dealing with kids, but what about teenagers? Like teenagers have a lot of issues in their head if they come to school life, and sometimes the issues get to their physical health as well. So what can they do to just calm themselves, and what should they do to just get rid of all the stress they have from school, parents, friends, and everything?
So teenagers with all their hormonal changes and all of that is a very turbulent time. And they need all the help they can get from all sources. So they now luckily most of these schools have counselors available, but unfortunately we have a lot of hitch in opening up to unknown people. There is this perceived lack of trust between the
Right.
two parties. And so teenagers first have to realize that that person means they're good, that they can approach a counselor or a third person who would be listening to them non-judgmentally, which is the most important thing for them,
Right.
and perhaps give them a better solution to their problems than their peer group. Also, they have to learn to communicate better with their parents, even though that's a very difficult thing to do. Easier said than done, but then they need to realize that they need to learn better with their parents. And yes, taking care of their health in general by exercising and sleeping well, eating better would help. Like at the crux of all of this is having a balanced lifestyle.
Yeah. So my next question to you is, you have these tiny, teeny toddlers and these little ones coming to you every day. They don't understand what's going in their head, and sometimes a parent is not also able to understand. How can a parent identify if the baby has some issue or is facing something? How, as a doctor, do you tell them, or do you notice some changes in the health issue, or if the baby has some issue with the mental health? Will it reflect physically or something?
Yes. So most of the babies who are suffering from some sort of psychological issue would present in a physical manner. Like a lot of them would complain of abdominal pain. They would come with recurrent abdominal pain without any obvious cause for it. Now, that's a functional way of seeking attention in some form.
Okay.
Or some of them would withdraw from food. They would stop eating. They would withdraw from their surroundings in general. They wouldn't want to go out to play with their friends. They would just sit at home or watch TV or something like that. And then at times there are more violent, aggressive behaviors which would surface. All of a sudden a child would become aggressive, would start hitting other kids, or hitting parents, for example. So those are the cues for us to look into if something is troubling. Also, there are certain other physical symptoms like bedwetting. They may have bedwetting, or frequency of urination may change. So if such things are happening, perhaps a parent should really look into the other other areas of life wherein there may be something concerning the baby.
Well, I think generally it doesn't happen. If the child is not eating, the parents going to take up the child. Oh, he has some stomach issues. Oh, they don't never think about the fact that, oh, he must be suffering from some mental issues.
Yes,
That
they
happens.
hardly ever do that. I mean, and particularly in our country, that is not the thing you emphasize on ever. You would think that it can be a lot of other things, but not this.
Yeah, I think there's a lot of stigma attached to it. Do you think
Yeah.
our country has attached a lot of stigma when it comes to mental health?
A lot, undoubtedly a lot. Even if people know that they're suffering, that they have some sort of depression, they would not want to take the treatment for it.
Right.
No, I mean, medical, as in prescription-based treatment, is something they don't want, and counseling also they would not approach very easily. So there's that needs to be overcome. Also, we need to make some policies or some OPD based questionnaire which we as clinicians can implement to identify more of these mental health issues in children, because I think we also tend to overlook and not really pay attention to these in our busy practices, because there's no objective way to measure it. So it's something which is often missed.
Right. So, ma'am, any final thoughts that you had about the session with us today at Solh?
I would say that the premise of your institution is very good. The whole thing of increasing mental health awareness amongst people, and today we talked of kids as well, is very, very important. It's the need of the day. Post COVID, we are getting children with all sorts of anxiety and depression issues, children who are unable to now adjust to going back to normal. Is becoming a norm, unfortunately. So I think firstly we need to, at a community level, we need to recognize that there is this issue. We need to find more ways to identify it, and then we also need to devise perhaps policies or get more trained personnel who can help us treat these in the long way.
Right. Thank you so much for being here. I hope you had a fun session.
I had a lovely session. Thank you so much. Thanks, Atan, for inviting me.
Welcome. We are hoping to see you soon back on the Soul app, and we'll be having more such sessions with you. It felt more like a chat show than a basic interview. It was just like a cup of coffee with a friend, as you put it, which I definitely needed today. Thank you.
I could be of help to you.
You were a great help to me.
No.
So have a great day, ma'am, and thank you so much for being with us.
Thanks a lot. Thank you. Bye.
So to all the viewers, we are signing off for now, but we'll be back with the next session very soon. Stay tuned. We'll be right back in a minute or so.